Okay, we're live.
Yes.
Hello, Sadaf. How are you?
Hi, Unag. I'm good. How about you?
I'm really good, thanks. And hello to everyone watching this video, which is going to be, we're kind of doing it secretly, so there's no live viewers, but many people will see it after we put it out on YouTube. So welcome all of you. The subject of today's discussion is a fun one, myths about homeopathy. There are a lot of, because homeopathy is not well understood, it's not even very well understood by our scientific community. There are a lot of myths floating out there about what it is, what it isn't. And so we'll just talk about some of our favorite ones today. So the first one on our list, we've made a little list of what we think are the most important. I think obviously the most important one is the myth that homeopathy is not scientific. So Sadaf, what do you have to say on this subject?
Well, this topic has been a lot debatable since the Lancet article, which came up saying homeopathy is a placebo effect. Okay. Or there was another person who said that homeopathy is just witchcraft.
Mm,
But these myths have been busted out by number one is by everyday clinical practice, where we see a consistent result coming in not one but different type of illness. And to
yes.
put like a feather on cap, there have been certain research that has been done in our country, that's in India. So number one was done by the IIT team under Dr. Jayesh Bellare, which proved that homeopathy is not a placebo effect, but it works on a different mechanism, that is nanoparticles. Okay,
Mm,
so the main thing why this myth started is because the one, like you can say, the haters of homeopathy or the those who are not agreeing with homeopathy try to put homeopathy in a different language of research and were trying to prove it, which is not possible.
yeah.
Homeopathy is based on a different philosophy. So you cannot, it's like if I start speaking to you in a local language of India, like if I talk to you in Marathi or Gujarati, will you understand it?
No.
No, you won't, right? None of the public will understand either.
Mhm.
So the same mistake happened with homeopathic researches. They were trying to put it under the protocols or under the design, the trial designs where homeopathy will not fit in. And then
Right.
try to prove homeopathy. Like if you try to prove belladonna works for headache, will be little
Mhm.
difficult because homeopathy is based on law of individualization, right?
Right. Yes, that is exactly. So we in homeopathy we don't treat the illness, we treat the person. So if you take 10 different people with headache, maybe two of them need belladonna and the other eight need other things, eight other things. And so in many of the trials, they said, okay, well, maybe belladonna is our most likely headache medicine. Maybe it was something else, but this is just an
Exactly.
example. And so we'll give 100 people belladonna. And so homeopathy didn't come out very well in that trial. Now, what's interesting, what I want to mention is that there are a lot of randomized controlled trials that are really at a high standard. And they're out there, they're published on the web, you can find them, and I'm going to give you some resources where you can look and do the research yourself. But so actually, if you take, I think the one of the European Central Council of Homeopaths has published something um, that if you actually, it might be one of the other websites, I might be mixed up, but they mentioned about 104 high quality randomly controlled trials that between homeopathy and Western medicine, and or conventional medicine, I should say, and that homeopathy actually in those trials, they came through overall about the same results as Western medicine in terms of how many studies showed benefit, how many studies showed, they couldn't really tell, and a small number of studies showed a negative result. Actually, the negative result was larger for the Western medicines, but just by a little bit. But that it's actually done very well in randomly controlled trials, even though in many of these, the situation was not correct for how we use homeopathy, and that they couldn't individualize properly and do what is the normal standard for testing drugs. So it is kind of like, my example would be, you have two people running a race, but one of the people, you tie their legs together. So when we have to, because we must individualize, we must treat the person to get the results that we expect in homeopathy. If that's not allowed in the trial, it's like the runner with the legs tied together.
Exactly.
Whereas it perfectly suits the model of conventional medicine, because conventional medicine is here is our medicine for this disease. So 100 people with this disease, or 1,000 people with this disease, we can give them all this medicine, and that is the standard of care. Well, the standard of care in homeopathy is individualization, treating the person, looking at the underlying patterns. How do you have this headache in a way that is different from somebody else who has a headache?
Right. Another important trial which was done in India was by Hapkin Institute, which is like around, you can say, 116-year-old institute in India, which is constantly doing a lot of research. And this research from this institute has proven that homeopathy is has a very good answer for tuberculosis. Now,
Excellent.
tuberculosis is a major problem in most of the Asian countries.
Yeah.
Okay, so in spite of the fact that the kids are vaccinated no sooner they are born, okay, in India, the kind of tuberculosis that has been coming up is multi-drug resistant tuberculosis.
Mm.
Okay, for which the Western medicine or the conventional medicine has no answer.
Yes.
Okay, whereas this institute was proven enough to show that homeopathy has a very good answer for tuberculosis.
Excellent. That's
Okay.
true.
One
Yeah.
more another research which is going on in India, which is of real importance. Everybody must have heard about hemophilia disorders.
Yes.
Okay, so there's one of my college professors, okay, who's been working on this research. His name is Dr. Tapas Kundu, and he's been working with hemophilic students, and to his surprise, and also to the allopathic doctors, in fact, the allopaths are the one who supported this research in India,
Mm.
because the factors that was required when the kids were bleeding started to reduce. The need of the factor started to reduce after homeopathy, and his research has been acknowledged by most of the American and other journals.
Oh, terrific. That's a
Yes.
beautiful
And
example.
yeah, and we all know about Dr. Prasanta Bannerjee, his research.
Dr. Prasanta Bannerjee, is this
Yes.
the cancer research?
Yes, the cancer research, which and that has been approved by an American institute itself.
Wow. Yeah.
Yeah.
So I would like to know that after we publish this video down below in the information, can you give me some links where people can look up and read about the institute you mentioned and Dr.
Yes,
Banerjee, perhaps?
yes,
If you
yes,
get
yes,
any good links you have to share.
yes.
And I want to share a couple of links from the Western world, and that I think are very good, have great information.
Mm.
One is from the UK. It's called Homeopathy Heals Me. So www.homeopathyhealsme.uk has a lot of good information in general about homeopathy, but you will see in there they have a latest news, and there's all, whenever there's a good study that's come out, that's in their latest news column. That will be very interesting for people to look up. There's another website from the European Central Council of Homeopaths, and their website is www.homeopathy-ecch.org. I'll put that below. And you go on their tab that's about evidence. Over on their menu at the side, click on evidence, and there's a really nice list of randomized controlled trials. And then another really nice resource here in the US, blog.homeopathic.com. That's the blog of Dana Ullman. He is a man who has been writing for decades about homeopathy. He's like a homeopathic journalist, and he's got great websites, but I really recommend his blog because he discusses a lot of the research, a lot of the science behind homeopathy. And I was going to say something about that, but yeah, do look that up. So the point is, I think we'll move on to the next myth, but the science is out there, and the problem is that
one more thing, the whole approach of how homeopathic medicines have been written are on the basis of provings, which the homeopathic doctors do it themselves on themselves. Okay,
yes,
so this is a very important point to say whether homeopathy is scientific or not, because it's been carefully studied. The symptoms are carefully studied by doctors themselves. So it makes it more scientific than any other science.
Yes, and now in this day and age, those homeopathic provings, when we test a new medicine, they do use a randomized placebo, and so it's starting to reach that standard. So yeah, that's very important that we know a lot about the medicines we're using. So let's go to the next myth, because I think that was the most important one that we needed to spend a little extra time on. And this one's a little bit related. You mentioned the myth that homeopathic doctors are quacks, that we're not really properly trained. So please, the standard is so high in India. You are medically trained in a medical college. So please tell me a little bit about that, how it is in India.
Okay, so in India, homeopaths undergo a formal training of 4.5 plus 1 year of internship. So it's total 5.5, which is almost equivalent to an MBBS doctor. So the only difference, and even the subjects, so we are studying anatomy, physiology, surgery, obs-gynac, medicines, preventive and social medicines. The only difference that a homeopathic study and an MBBS study is that in homeopathy, we are studying homeopathic drugs and philosophy.
Yes.
Okay, whereas in the students who are attending an MBBS college are putting their efforts on the allopathic medicine, that is the pharmacology. In fact, now in India, there has been a course which is being sanctioned by the government of 1.5 years. So homeopaths study extra, that is the pharmacology also. So that makes you 6.5 years.
Wow.
If you want to know pharmac also. So homeopathic doctors are have more potential than allopathic doctors.
Interesting. Yeah, it's a very specialized and very in-depth training.
And nowadays, we also have specializations in homeopathy, like master's degree. Okay, so we have MD pediatricians, we have MD medicines, we have MD in homeopathic subjects itself. So, which is 3 years again, if you want to do MD, right? So we do have a proper training system as equivalent to those who are in the other school of medicine.
Yes. Now, so let me tell you a little bit about the West, just to compare. Here, there's not one standard. I mean, obviously, the West, there's many countries, and it's different in different countries. So we have different kinds of homeopathic schools, and some of them are longer than others. In the UK, which is the tradition that I come from, even though I'm American, well, there are four-year colleges, and I did the first 3 years of a UK college, and then I did the equivalent of the fourth year, and some different postgraduate programs, and one in Canada, and then I came to you in India for clinical studies. So in the US, it's a little bit, you know, we choose some of the different pieces, but we do a very in-depth training, and that you know, my first 3 years of homeopathic college from England was a distance study, but it was very intense and very involved. And it included anatomy, and it included anatomy, physiology, and it included pathology and disease, so that I would have a full background in those things. Yeah, here it's a little bit more, and we also have naturopaths over here practicing homeopathy, and they have their different kind of training. And we also have doctors, MDs, who have become homeopaths, and they have their different training that they just kind of added to their program. So it's very diverse over here. So in general, there are a lot of extremely well-trained homeopaths, and I can attest personally that most of us never stop studying once we get on the homeopathic track, because it's like there's a universe of medicines out there to learn about and to research, and to be creating discovering new medicines. And also, there's evolution of techniques. And in Mumbai, you have been a big part of that, the evolution of the vital sensation method in homeopathy, which is very important. So we'll come back to that. Let's go to our next myth.
Okay.
And you had brought this, oh, no, my daughter brought this one. So I asked my daughter, because she's not a homeopath, you know, what do you think people should know? And she said that she wants people to know that homeopathy is not anti-conventional medicine, and that people can actually combine the two approaches and use both. Some homeopaths will tell you otherwise, but you know, and I know, and you know, the doctors in India know this very well, that we combine these things as needed, and that it often has a lot to do with, sorry about this pinging, with it has very much to do with the choice of the patient, or the choice of the client, as we say here. And so often when people come to work with me, they are already on conventional medicines, because they're dealing with serious problems, and we can't just take them off of those medicines. It would be a disaster. So, but working over time with homeopathy, my goal is to get them to a place of such increased health that they no longer need those medicines, and that we see very often. That people are able to get off of those medicines, but we don't encourage them to come off of any medicines without the advice of their doctor, without collaborating with their doctor.
Right. So with conventional method and homeopathy, it's very clear that homeopathy is not anti any medicine. Okay, it's just that certain conditions, okay, may or may not require conventional medicine, or they might come. For example, if there is a case who has a history, okay, of skin symptom alternating with asthma.
Yeah, skin symptoms alternating with asthma.
And in this case, if you get after homeopathy, if you're given homeopathic medicine and your asthma is relieved and you get a skin symptom, okay, which is actually a very good sign for homeopathy, because
Yes,
homeopathy believes in exteriorization. So at this moment, most of the homeopaths will say to avoid creams, okay, which contain
yes,
steroids, okay, or
yes.
any kind of antifungal or antibacterial cream which is going to suppress the skin eruptions,
Yeah,
because
that's
these suppressed eruptions might cause a higher disease, that is asthma or any other problem. So
right.
these cases we are little sensitive about. But if you have
Yeah,
high blood pressure or very high diabetes, or you have a cardiac problem, or you're having cancer, no homeopath is going to cut down your allopathic medicines, okay,
that's right.
because we do understand the medicine which you're on, okay, have certain effect on you. The moment I reduce your blood pressure pills or your diabetes pills, your body will go on toss. You will not
That's
be under control of anything. And we also, as a homeopath, will have a confused picture of your disease. So
that's
we do not interfere with your allopathic medicine in this cases. So, but yes, once your medicine has started taking control over your body, your need of that medicine reduces.
that's
So
right. And then the
already
doctor,
your diabetes level will be such that you will get more hunger pangs, so you'll have more time of hypoglycemia. So your allopathic doctor will himself says, do you need to reduce your diabetes medicine, or your blood pressure is so low that you need to reduce your blood pressure medicine. Right?
exactly. And I just want to also say, so you said something very important that I think might be a little hard for people to understand if they haven't already worked with homeopathy, and that is, you talked about you're treating someone for asthma, and as when they get their homeopathic medicine, maybe their asthma gets better, but maybe they get a rash like eczema.
Right.
And so there's a very important reason why we would say not to suppress that eczema, because this is actually one disease being expressed in different ways. And what's safer, asthma or eczema?
Right.
Eczema is safer. So, as someone is getting healthier, their disease will come out in safer ways. So if you have asthma, your asthma gets better, but eczema comes out, it means you're getting healthier. And if we suppress that eczema with steroids, then the asthma can come back. So
Yes.
it would be pushing it back in other words. We want exteriorization. We don't want the eczema to stay. If the asthma is getting better, it means the person's on the correct remedy, and the eczema will also go too. But it has to go naturally when the body is done
Yes.
exteriorizing that illness.
Yes. Body should have the control of your cure. So once
Yes,
that is achieved, we don't want to interfere with it. And that's the reason why most of the homeopathic doctors will say no to any kind of a cream
that's
which
right.
is going to suppress. Yeah,
Yeah.
but if you are under antidepressant, or if you are under any other anti-anxiolytic medicines, which for now given condition has not aggravated you, we will not immediately cut it down till your body says, okay, I'm ready to fight it on my own. So
Yes.
we're not anti any pathy. It's just that we have to make certain decisions based on your vitality and on how we want the cure to happen.
And there's one more really good point connected to this. That is, sometimes many clients who come to us, many patients who come to us, come because conventional medicine has said there's nothing more we can do except manage
Exactly.
your symptoms. So we deal with chronic illness, and we can make curative progress,
Yes,
bring people to cure in situations where conventional medicine didn't have any more answers.
yes. So in that case, one more good point that you have pointed out is the conventional medicine. There are many cases where the conventional medicine have done more harm than benefit. Okay,
Yes,
so
this
you
is
have
true.
been already on a lot of side effects because of XYZ medicine. Okay,
Yes,
so why do you need to toxic your body more and more by continuing it. So we kind of advise you taper down that medicine. I'll give you a simple example. We have a case of a renal failure, okay, and this patient had was for on a long time on medicines for gout. Okay.
Yes.
So they were given Xyloric. Okay, you know it is a mostly given medicine for high uric acid level. So
Mhm.
now this person, when we were evaluating the symptoms, we found that the symptoms that the patient was giving was actually the side effects of this medicine.
Ah,
Okay, so we see a similar lot many cases, and this patient got immediate relief even before starting homeopathy by just stopping the Xyloric.
yeah.
And
So
then
sometimes,
what happened is the gout surfaced, okay,
mm,
because we have stopped Xyloric. But then the homeopathy had a good chance to work on, okay, because the artificial disease was removed. We
yeah.
could see the real picture of the disease, and now the patient was helped better.
Oh,
So
good.
we see
Yeah. Is
many similar cases where you know that okay, these things which are coming up, chemotherapy for example, okay, we have
yes.
many times cancer patients coming to us with a lot of side effects which have been developed after chemo and radiation therapy. Okay,
Yes.
so then what do? We cannot stop immediately chemotherapy or radiation therapy, but we do have good remedies in homeopathy which can help with side effects of chemotherapy and radiotherapy. Let the good effect be, and side effects just get out of your body. So it's that
Yes.
simple. There is no antagonism. We can always work with synergy.
That's right. We work together. It should be a collaboration. And India is a perfect model for this collaboration. And I hope that we get to that point in the West where doctors and homeopaths and different kinds of alternative medical practitioners can collaborate. And so, you know what? I think that our video is going to get longer than it should really be.
Yes,
I think we need to do a part 2 of myths.
yes,
And I want to give a little sneak preview of the next really, this is very close to my heart and I know is really important in your experience there in India. There's a myth that people who are just beginning to understand, or maybe they've worked with one practitioner or read one book or a certain website, there's a myth that they will get the idea that there is only one correct approach for using homeopathy and that the other approaches are not good. So this is really a big one because this, there's been some antagonism between different schools of thought in homeopathy, just like in other disciplines. People get entrenched into thinking my way is right and try to spread that idea to their clients, to their patients.
yes,
And now we're working hard in homeopathy to dismantle that
yes,
mentality, because the different schools of homeopathy have a lot to contribute based on their special understanding. And so we need to start having an open mind. So I think that's where we'll start in the next video.
okay,
Okay. Okay. Thank you so much
yes,
for talking with me today, Sadaf. It's
yes,
such a pleasure.
yes,
Okay. And goodbye to everybody. Thank you for watching. And I hope this information that we've been able to share is of great help to you. And I wish you all well and your wellness journey. Take care. Bye.